I'll start my presentation with a little bit of video. One of the problems, one of the successes of aviation is that it's a relatively new activity. It's really only 100 years old, whereas medicine is thousands and thousands of years old. Healthcare, I would say, is only a few years old. Like lots of things in Ireland, we're old soldiers, but we're a young army. We're an old state. We're an old nation, but we're a young state. So things are relatively new with us, but particularly with aviation and space travel. It's all very, very new, and it's all very, very daring and risky, or it used to be. And of course, the synergies are that people who make airplanes don't particularly want them to be involved in accidents. People who operate them don't particularly want them to be involved in accidents. People who fly in them obviously don't want them to be involved in accidents, and people who fly them certainly don't want. So you have a synergy there where everybody because there's no question of the survivability or sustainability of the activity. But just before I start, could I ask just to say, the audience, what's the composition? How many are doctors? None. How many are nurses? Good. How many are managers? Very good. Okay, so we've a cross-section. We've no doctor. Have we no doctor in the house? No. Okay. Ah, good. You're isolated. My own experience with nursing is that I did my prelim in Vincent's and I did my midder in Holles Street. That was the kind of synergy at the time. Air Corps pilots seemed to be attracted to nurses. But anyway. And we both led very, very disciplined lives at the time. I remember a student nurse had to be in at 10 o'clock and had to queue to be paid. And I remember that some of the nursing directors were pretty formidable ladies from the various orders who had a stark similarity to some of the sergeants major that got us at 18 and got us young, treated us rough and told us nothing, but made men of us in the end. I'll just start with this piece of video, which is the kind of the iconic...
At 2:24 a.m. Eastern Standard Time on March 27, 1977, Pan American Flight 1736, a Boeing 747, took off from John F. Kennedy Airport in New York City, bound for Las Palmas in the Canary Islands. 1 hour and 18 minutes later, KLM Flight 4805, another Boeing 747, took off from Schiphol Airport in Amsterdam, also headed to Las Palmas. While the two aircraft were en route to Las Palmas, a terrorist bomb exploded in the passenger terminal at the airport. As a result, all aircraft destined for Las Palmas were diverted to Los Rodeos Airport on the island of Tenerife. Due to congestion at Los Rodeos, both 747 aircraft were told to park in the holding area for runway 12, with the KLM aircraft closest to the runway. Several hours later, after the Las Palmas airport had been reopened, the Pan American crew prepared to proceed to Las Palmas. However, when they attempted to taxi to the runway, their path was blocked by the KLM airplane. At 4:58 p.m., the KLM airplane asked for and received permission to enter the runway and begin taxiing to the holding position for runway 30. The initial clearance to the KLM airplane was to exit the runway at the third taxiway. This was later amended for the airplane to backtrack, that is, to taxi down the length of the runway and execute a 180-degree turn. At 5:02, the Pan Am airplane was contacted by the tower and told to travel down the runway and then exit it using the third transverse taxiway, taxiway C3. This would clear the way for the KLM airplane to take off. The first two taxiways, C1 and C2, were unusable due to the numerous aircraft diverted from Las Palmas that had been parked on the taxiway parallel to the runway. As the Pan Am aircraft began its taxi on the runway, there was some confusion as to which taxiway they were to use to exit the runway. The tower confirmed that they were to use the third taxiway, C3. At 5:03, the KLM airplane told the tower that they had just passed taxiway C4. The tower replied that the KLM airplane should execute the 180-degree turn and report when ready for ATC clearance. There was intermittent fog during the taxi of the two airplanes. Runway visibility was measured from a device 70 meters south of the approach end of runway 30. Runway visibility was measured at 2,000 to 3,000 meters at 450, 300 meters at 502, and 1,000 meters at 510. The variable visibility was due to fog that was being carried along the length of the runway. The visibility deteriorated to the point that aircraft taxiing on the main runway, as well as some located in the parking area, were not visible from the tower. At 5:04 and 26 seconds, the Pan Am captain stated that they had passed the C1 taxiway. At 5:05, the tower informed the KLM and Pan Am airplanes that the runway's centerline lighting was out of service. In response to the tower communication, the Pan Am captain informed the crew that with the centerline lights out, they would need 800 meters of visibility in order to take off. The captain also noted that they were passing taxiway C2. At 5:05 and 53 seconds, the tower provided the KLM airplane with its ATC clearance. At 5:06 and 9 seconds, the KLM airplane read back the clearance and announced that we're now at takeoff. At 5:06 and 11 seconds, the brakes on the KLM 747 were released, followed 3 seconds later by throttle movement in order to set takeoff power. At this time, the KLM airplane was rolling down the runway. At 5:06 and 18 seconds, the tower controller replies, "Okay," followed 2 seconds later with "Stand by for takeoff, I will call you." Concurrent with the controller's request to stand by for takeoff, the Pan Am airplane announced on the radio that they were still taxiing down the runway. The simultaneous transmissions caused a shrill noise in the KLM cockpit, making the transmissions difficult to hear. At 5:06 and 25 seconds, the controller asked the Pan Am airplane to report when they were clear of the runway. Pan Am responded that they would report when clear. This transmission was heard in the KLM cockpit, prompting the KLM flight engineer to ask the KLM captain, "Is he not clear then?" The captain didn't hear the question and responded with, "What do you say?" And the flight engineer again asked, "Is he not clear, that Pan American?" The KLM captain responded to the second question with an emphatic, "Oh, yes." At approximately 5:06 and 38 seconds, the Pan Am flight crew saw the KLM airplane coming at them out of the fog. The Pan Am crew attempted to avoid the collision by accelerating and turning left towards the grass. 9 seconds later, the two airplanes collided on the runway just short of the C4 taxiway. Of the 248 passengers and crew aboard the KLM flight, there were no survivors. 335 of the 396 aboard the Pan Am flight were killed, making this the deadliest accident in the history of aviation.
Okay, so the reason we show that particular piece of video to every single pilot and everybody who's undertaking a course is that that is the worst aviation accident ever. 587 people killed in one go. And it changed the way people were trained. It changed the way new subjects were added to the curriculum, a subject called human performance and limitations. And this is basically to get people to understand how their body works, how their personality is formed. And it met with huge resistance initially from the old sky gods, as they were called, the old captains like this man, Van Zanten. And he has actually gone into the literature and the very essence of aviation safety for all the wrong reasons. Now, I'm not so sure that that's a fair assessment, but I'll read something for you at the end. But to give you an idea of what the aviation industry in Ireland is, we have 26,000 people directly employed. It's worth about 4 billion to the GDP. We have a huge leasing industry here, which was built up initially by Guinness Peat Aviation, Tony Ryan. That subsequently went into liquidation, but the whole concept of leasing stayed very strong in Ireland. So there's 100 billion assets under management from the Financial Services Centre here. 35% of the world's global large transport fleet are leased, and that will move towards 50% because airplanes are so expensive that it's a capital outlay that people are not prepared to make. A small amount of money comes in taxes, and there are over 1,000 people involved. And the Cape Town Convention, which governs the leasing of aircraft, is based in Ireland. And basically that means that the airplane is viewed as an asset, so that if for example, this airplane has been operated in Malaysia or any other continent, under a local law there, it could be seized as part of the assets of the company. But under the Cape Town Convention, and indeed under Irish property law, you can't do that. So the asset can be brought back to Dublin or to somewhere else. The international standards in aviation are very strict. They're basically controlled by international convention by the International Civil Aviation Organization, which is a UN body which was established in 1944, coincidentally at the same time as the UN Convention itself and the formation of the UN. Now, Ireland played a very important role in this because obviously during the war, Churchill, to get to the United States, would have to go through fines in a Sunderland flying boat. And that's how the whole concept of Shannon and Rhinana and all that kind of thing emerged. And because the airplanes wouldn't have the range, they used to refuel at Shannon, and Shannon kept its pivotal place right until the 1960s, until the arrival of jumbo jets and things like that, which could overfly it. But it still has a strategic importance. The IAA then is the state body for aviation. We have about 700 employees. We're based in Delir Street. We have a dual mandate. One is to provide air traffic control, and the other is to regulate aviation. A bit of a conflict of interest, you could argue, but we are functionally separated, if not institutionally. The interesting thing about Ireland and ICAO, and I'm just back from the Assembly, is that it behaves exactly the same way as the United Nations. 191 countries take their seats in an assembly in Montreal. Every 3 years, the standards and recommended practices are established for every single aspect of aviation. There is a convention called the Chicago Convention of 1944. Ireland signed into that in 1946. And then the Air Navigation and Transport Acts made that into domestic legislation. Now, the convention is an international convention, and unless, of course, it's transposed into domestic legislation, it doesn't have any weight. Ireland was very anxious to be involved in this, not just because of the position of Shannon, but we weren't part of the United Nations, of course, until the 1950s. So we were very pleased to be involved in United Nations activities. Obviously, the European Union, and under the Lisbon Treaty now, all the technical competence and the legal competence for aviation is vested in the European Commission. We don't make any domestic legislation at all, except for like home-built aircraft. Otherwise, everything is regulated from Europe. And this is by the European Aviation Safety Agency, EASA. Now, as part of the European Union body, I serve on the management board with a person from the Department of Transport as Ireland's representatives on that. And then in Eurocontrol, this is another European agency which controls air traffic control. These are the manufacturers, and then obviously the Department of Transport. And then these are all inputting into the authority as to what it has to do. And of course, we're audited on a regular basis by these people. In the industry itself in Ireland, you can see that we don't really have, for a small island, we have an awful lot of airports and we have an awful lot of aviation. So airdromes and airspace, you can see the figures there. And airworthiness, we have 762 large public transport aircraft. Half of that is made up by the leasing industry. These airplanes would never be in Ireland, so we have to be very careful that we're not branded as a flag of convenience. So we take a very great part of our staffing requirements are to be able to oversee every single Irish airplane is visited by an Irish engineer once a year at the very least to give it what's called its certificate of airworthiness. On the operations side, we have 14 airlines and commercial operators, and we issue them what's called an air operator certificate, We have 1,600 students, 5,700, and all these people are licensed by us. And then in air navigation, the air traffic controllers, radio officers, and as I said, because Ireland's gateway to the Atlantic, we control the airspace out as far as 15 West. And then ATC, radar and communication systems. So they're all regulated. Every single aspect of this is regulated. Obviously, our friends in Ryanair bring us in to be a major player. We now, when we analyze our data, it's really useful because it's taken from, the data are taken from a large operator. You can see there now that it's almost 3 times the size of the whole industry put together. So that makes the data that we gather usable when it's normalized, that you can actually say, okay, so many airplanes took off, so many landings, so many fires, so many decompressions, so many cabin crew injured, so many events that happen, right down to people being burnt by the coffee being too hot or whatever. That's all input on a weekly basis, on a daily basis, and then it's analysed every Monday by our staff and by the Air Accident Investigation Unit, who are separate. So Ryanair themselves, and the reason I use them is, as I say, is they're going to go to be basically the biggest airline in Europe. They do 80 million passengers, which is far more than British Airways or Lufthansa. And of course, this focuses the amount and the way we regulate them, obviously by the other countries, because there's always the allegation that, you know, there's a bit of regulatory capture here, that you're a bit too close to them. If you look at the North American carriers, this is the kind of network that Southwest has. Delta, then, you can see these operators would have 1,000 aircraft, and South American Airlines and JetBlue. So that's the kind of network. Now, this is the Ryanair situation in Europe, which is remarkable when you compare it to Lufthansa, Air France, British Airways, or indeed Turkish. So they have 1,800 departures a day, and it's all systemized. There's only one way to do it. And this, of course, makes them relatively easy to regulate. Just apart from whatever travel experience you might have with them, from the safety point of view, I don't mind whether you buy your food in Fortnum and Mason's or in Aldi, so long as the food is safe, and it's something similar with Ryanair. Also regulated, we have all these other activities, right down to fellas parachuting and all that kind of stuff. And actually, they give us more trouble than the structured, regulated airlines. So this is Ireland's safety record or rating, and it's this is now 100% effective implementation of ICAO requirements is the criteria. We're at 7.72. Now we incur 1% of that because we're in EASA, because they don't do it. They have a 1% non-compliance. But the interesting thing about UK is that that's UK Europe, so that's not their dependent territories or their islands or anything like that. And similarly with Netherlands, their figures would be far higher as effective implementation. Now the interesting thing is that a friend of mine in the FAA has done a study about the comparison between the safety of your aviation system and your infant mortality, and I thought this might just make some kind of interesting comment to the audience I'm speaking to. He also has done some work on GDP, and basically what you find is that if you have a good aviation system, a good aviation safety system, you'll probably have low infant mortality and you'll probably have a reasonably high GDP. Not rocket science, you would say, but interesting nonetheless, and that's just the explanation of it. So they're the kind of figures that we have extrapolated from the data available, and as you can see, it's pretty consistent. But and this reflects very favourably, I would say, on the maternity care that we have in this country, notwithstanding any random events. The evolution of aviation safety is that basically, as the technology improved, the accident rate decreased. and this is per 10 million flights. So we have about 5 accidents a year. We kill about 1,200 people a year worldwide in aviation. And since the advent of commercial aviation, about 14,000 people have been killed. Now, I don't like making comparisons with other modes of transport, but in Europe we kill about 40,000 people on the roads every year, and in the United States it's something similar. So you can see that aviation is quite safe as a mode of transport. In fact, if you went on an airplane every day for 30,000 years, you would be killed. The only problem is you wouldn't know what day it would be. So that's the nature of this random unpredictability. The game changers in aviation, of course, were the technology changes. Now you can see the Comet was a public transport aircraft that the British tried to build in the 1950s, and it crashed on several occasions, and Churchill ordered that the thing be grounded, and they find out exactly what happened to it. And this was because basically it was a pressurized vessel, but it had square windows, and they didn't realize that the square windows would not be able to take the pressurization. So in fact that airplane still operates as a Nimrod for the British military, but it didn't break into the commercial thing. This was taken over by Boeing with the Boeing 707. Tenerife, as I said, introduced human factors and crew resource management. The space travel probably sets the benchmark for research, development, pushing the limit, and of course they had a huge failure rate with Challenger and Columbia, and remarkably for very basic reasons. The British Air 2's fire in Manchester changed the way we try to get out of an airplane, and you'll see in the safety briefing the girl will say, or the cabin crew member will say, and if you look at the floor lighting, this is to be able to guide you when there's smoke. These are the game changers. Aviation is kind of a tombstone changer. You know, you have to, as my friend says to me, you have to get the blood sacrifice before the regulators and the industry and change because of the economic impact. And obviously 9/11 changed everything then for aviation, because we always had hijacking, but now our airplanes, our beloved places of work, were now being used as weapons of mass destruction, so you had to take a different view. And of course, the most recent crash with Air France 447 coming up from Rio, which 3 Irish doctors, I believe, were killed, changes the game because of the complexity and the technological advances and what we call the human-machine interface, where the airplane is so sophisticated and the technology is so sophisticated that nobody really knows what it's doing. And you have 3 computer systems that have a triple redundancy, and yet it can go wrong. And of course, the problem is when something unusual happens, the computer will only deal with what it's been told can happen. It can't deal with the unforeseen, whereas the human still is, hopefully. But of course, this brought into the question of how a human reacts in a difficult situation. These are the fatal accident rates by region. You can see that North America and the more developed societies have a very low. When we categorize things, you'd see that when we look at commercial air transport from 2004 to 2010, you can see how we try to reduce the particular incidents. And you can see that runway safety is still a major problem, despite 36 years ago, all we tried to learn from Tenerife. Loss of control in flight, compounded by the Air France 447, is still a major killer. And controlled flight into terrain, that's where the airplane actually strikes the ground and nobody really knows what's happening. Now, technology has advanced, and despite all the technological advances, these things still happen. And of course, security. We now, in the Irish Aviation Authority, since the 1st of January, have had to take on this, because with cutbacks, the Department of Transport have no staff, and they're being cut back further, and the agency was asked to take over this. Now, the authority is funded through fees and charges. We don't get any money from the state. We have to go out and charge appropriately, and that is regulated then by the civil aviation regulator, the CAR. So there's safety regulation and commercial regulation. What we do is we adopt a life cycle approach, and this would be familiar to you. So we have, to get into this industry, we have transparent gates and precise rules for entry control. The rules are then for continued operation, rules to maintain confidence in the system, provision of support for the system, and rules, that is, we have to have some teeth to force people to do the right thing. And then when you exit the system, there are rules for that. So that's to do with everybody who's in the system and everything that's in the system. So whether it's a piece of equipment, we know where it comes from, the OEM, the original equipment manufacturer. It's then certified, it's then inspected, and then, for example, if it moves from one airplane to another, there's a record kept of it. And then when it's to be scrapped, when its life cycle is finished, it's out. And similarly with an old pilot like myself, they give me my license, they check me 3 times a year, they medically examine me twice a year, and if I fail in any one of those things, my license is gone. And that's how we keep control of it. It is strictly regulated, and of course there's demand for less regulation because of the cost of it. ICAO's definition of safety is the state in which the possibility of harm to persons or property is reduced, and through a continuing process of hazard identification and safety risk management. Now these are the buzzwords: safety risk management and HAZ-ID, safety risk management. And this is one of the problems, and in all your literature on safety, both in aviation and what are called high-risk environments, the gurus are James Reason, Professor James Reason, and Sidney Decker and Eric Holnagel, and there doesn't seem to be anybody willing to challenge the kind of perceived wisdom of these people. But there are quite a number of young people that are saying, you know, it's too easy to categorize and box off how this is done. But of course, society demands, the level of expectation is that if you get into an airplane, and remember now what an airplane does. It's a pressurized tube. It takes off at about 140 miles an hour. It climbs up to the edge of space, and it flies along at almost the speed of sound. People 20 minutes late getting to Rome or Athens or New York, they're given out. The tea isn't right, the coffee isn't level. You know, if you're walking around in an airplane and it hits a bit of turbulence, you will be injured. You will break your neck or your leg or your hip. If you are carrying an infant, it will become a missile. If the pressurization fails, if you don't get oxygen on within 90 seconds, you will die. Now, what we've done is we've marketed this, and of course the marketing people have marketed, you know, you could see the ads, you know, fly to Dubai, and you're laying out in your bed, and there's this beautiful girl serving you your gin and tonic or whatever. And they've marketed this, but we have to keep the pressure on the technical side to make them realize exactly what's happening and what the potential risks are. But of course, as I say, it's been so successful that it's very hard to keep the pressure on. And of course, we have a serious system of accident investigation, and this is what it tries to do. Now, there's a lot of controversy over this because in some countries, when there's an accident, it's given straight over to the judicial people. If you're in a Code Napoleon country, that's what happens. If you're in a common law country, it's normally given to the technical investigation. And of course, ICAO, when we go to investigate an accident, when I was an accident investigator, it shall be separate from any judicial. So you're not out to establish blame or liability, you're trying to find out what happens. It's a crude method of prevention. And what's in common? What have both these systems got in common? Well, of course, very, very few people die in aviation accidents. But of course, it's the suddenness, the impact, the concept of the hero and the villain. Now, you've very much got that in your own profession, most recently with failures just north of here and in the west. And then, of course, you've got the cause. What was the cause of this? Who's the hero? Who's the villain? Who's the victim? And of course, the media are straight in. And one of our problems, of course, is that the media are very, very powerful. And they go for 3 things. They go for simplification. Complexity is to be avoided at all costs. The nuances of the case, of the professionals, can't deal with that. Personalized. So immediately they get to the human, the victim, the patient, the doctor, whatever it is, the pilot. And the symbolization. You can see it in the papers, you know, patient bleeds to death, you know, terror in the sky, chaos narrowly avoided, all these kind of things. And this is to attract attention and sell newspapers. You never let the truth get in the way of a good story. And of course, there's the concept of culture. You hear that word used nowadays all the time. And James Reason says, few phrases occur more frequently in discussion about hazardous technologies than safety culture. Few things are so sought after and yet so little understood. There are 166 definitions of culture. There are 166 definitions of justice. So what we have in aviation is we have a mandatory occurrence reporting system, voluntary and confidential reporting, not anonymous. We won't deal with anonymous reports. And you have a safety management system and a quality management system. And briefly, these are the categories. We get 7,000 reports a year. And these are the categories. The top there is loss of control on the ground, and the bottom is system component, non-failure, non-power plant. Oh. What does that mean? Okay. And where we have the red is where we believe that there's no barrier left to the accident. So you can see that maybe 6,700 of these would not be risk-bearing, that there would be a barrier before any disastrous outcome. But we do get these, and this is the way we focus our regulation then. So we go to the operators and we say, hey, do you notice you have had so many heavy landings this month, or you've had so many cabin fires or smoke in the cabin, or a lot of it, of course, is incapacitation by patients, and you get people diverting. This thing is not working now. Sorry about that. Good. Has it gone? Yeah. Great. So the way it's driven worldwide is that ICAO do a safety plan. This is called a GASP, and everybody gasps. Then we have a European Aviation Safety Plan, and then we have a state safety plan. And these all have to flow into an acceptable top 10 desired outcomes as set down by EASA. And how risks are assessed then, there are several models, I'm sure you're familiar with them, but the most popular one for aviation and human factors is the Shell model, where S is the software, livewire, and the environment. And what you're looking at, the human, how he, and the atmosphere, or the environment rather, can be either in the cockpit or it could be the weather. It could be on the ground or it could be in the air. And basically what you look at is the interactions. This is the ARM score that we use in our risk management. This is a fault tree analysis. This is a bow tie where you have the prevention on one side, the unsatisfactory outcome. Now that could be easily applied to medicine, the treatment of diabetes or conditions, and then the event happens and then you try and manage the lifestyle afterwards. All directly applicable to anything. And of course, what we have in aviation is what ICAO want people to do on the human factor side is that the organization must have a vision. It must have a philosophy. These are called the 4 Ps. What is the philosophy? What is the policy? What are the procedures, and do they reflect the policy and the philosophy? And then, of course, what's actually been done? What's the practice? So if you go out to look at an airline or an airport or a maintenance hangar or a workshop or whatever it is, what are the guys supposed to be doing? That's laid out, they all know what it is. What are they actually doing? And very, very often, 90% of cases where there's a failure, you'll find that the standard operating procedure has not been adhered to. And the reason for that is, of course, the requirement for a speedy turnaround, efficiency, and this is the management dilemma. In management levels, and of course, you have your resources for protection and you have resources for production. If you focus on production and you don't put in the balancing protections, you will have catastrophe. And if you do the opposite, you just become inefficient, you go bankrupt. And so it's finding the balance is the main problem. I'm running out of time now, so I'm just going to go on to what our threats are and the potential to predict the future. Our threats really are the technological complexity, and both in the airplanes and in our air navigation systems, and how vulnerable they are to cyber attack. Most of these things are operating on software, and the CIA and all these guys will tell you that this is how they upset the Iranian nuclear program. Is you put a James Bond guy in, and he puts in a piece of malware into the system, and now you have a recurring fault. Maybe it presents itself after 10 days. You put in your antivirus stuff, but they have contaminated the antiviral already with another unknown virus. And then 28 days later, your system becomes unstabilized. And the problem, of course, with anything is if you can't find the cause, trust in the system evaporates. The people operating it, what's this thing doing now? And of course, the people who are going to be the victims of this or the beneficiaries are even in a worse situation. So that's basically the main threat. These are the kind of incidents that happen. This is a bird strike. And the other problem, of course, is the criminalization of error. And one of our problems is that people now are whisked off to jail, particularly in the Code Napoleon countries. If you crash, if you're involved in an airplane incident in Greece, Spain, or Italy, it's the police who come and see you, not the safety guy. It's the judge who takes the cockpit voice recorder. And these are the main challenges we face now in trying to get data and being able to protect it from improper use. There's nothing to say that an FOI, a newspaper, for example, in Denmark up to quite recently, an accident investigator's notes were FOIable. The media could come along the crash site and say, I want to see what you've written down there. Now they've changed that to a secrecy law. But of course, the pendulum goes in the other way. I'll just go now. I'm just going to finish because there are a couple of things that I just want to say about is fairness. My master's is in ethics for professionals, and basically what you're trying to do is to be fair. That's the definition of justice. You know, if a person makes a mistake, an honest mistake, you can't punish him. You must go for the learning outcome. Or as the Americans say, the takeaways. What are the awesome takeaways here? We call it learning outcomes, you know, we're more civilized. So how do we assess safety? It's not the absence of unacceptable risk. It does not mean risk-free. And it's not fair to say that hospital A or airline A is safer than airline B. It's not necessarily true. And you can't do that, certainly, if you have no data. And of course, you've got to be flexible. And the two things that we're talking about is a safety management system and a quality system. The quality system basically ensures that the procedures and the practices are being followed. The safety management system looks at where it's failed and how can you address it. Nothing's changed. These are the Wright brothers, 1903. And his risk assessment is, I will not do anything dangerous. I do not intend to take dangerous chances because I have no wish to get hurt. When a fall would stop my experimenting, which would I not like at all. But of course, immediately they became market-driven. And there was a huge amount of money from the American military. And you can see there that it was lowered by $2,500 a mile, less than 40, and raised, so the competition was on. This is the first demonstration by the Wright brothers to the American military. This man's name is Selfridge. It's rumored that he was in the pay of Alexander Graham Bell, who wanted to develop an airplane to challenge the Wrights. And of course, it crashed, and he was killed. And his brother was in France, one of the Wrights, and he said, if I'd been there, I could have held off the visitors while he worried, or let him hold off while I worked. Man cannot take sufficient care when he is subject to continual interruptions, and his time is consumed talking to visitors. And that's why people aren't allowed into the cockpit anymore. Apart from the security thing, in an awful lot of incidents and accidents, you'll find that there was a girlfriend or there was a cabin crew member in talking about where they were going to go that night, or somebody had his girlfriend or his wife in the jump seat. So the concentration wasn't on the job. This is about NASA, and I'd encourage you to read the reports into the Challenger and Columbia accidents, because it's really about leadership. And this is what Admiral Gaiman said, and I think it's very important for people. Leaders are responsible for establishing conditions that lead to their subordinates' success or failures. The past decisions of national leaders, the White House, Congress, set the Columbia accident in motion by creating resource and scheduled strains that compromised the principles of a high-risk technology organization. The measure of NASA's success became how much costs were reduced and how sufficiently the schedule was met. And this was to an organization that had been given unlimited resources to put a man on the moon and who believed that they could do anything. That's about the NHS. I won't go into that because you'll deal with that yourself. But these are the active failures and the latent failures, and we always have them in organizations. Resident pathogens, you know this from your own things. So the point there about mosquitoes is that when people say that mosquitoes carry malaria and they live in the swamp, so how do you get rid of them? You drain the swamp, and then the mosquitoes are gone. But as they say, when you're up to your arse in alligators, it's very hard to remember that you came to drain the swamp. And to address latent conditions, you have to strike at the heart of the organization's culture or dominant paradigm. And you've got to change the core beliefs and values. I will just leave you with two quotes. Gogarty was a great hero of mine, he's a great man. And he said, "There were 19 hospitals in Dublin, and all of them were unmergeable into one. Grants and endowments were denomination, and the whole problem of the treatment of the sick appeared to be one of wastes, overlappings, and abuse." Nothing's changed. No, I didn't say that. And of course, when we tried to establish a Department of Health here in 1949, a government minister said a Department of Health was unhelpful, unnecessary, and unwelcome. Now, of course, you know yourselves that this was because they thought they were going to mirror the Nye Bevan thing, but this is what Riley is trying to do now, I would conjecture. And of course, the whole point is, at the end of the day, it's really about ethics and virtue ethics. Has the person, the leader, whether he's a doctor, a nurse, a pilot, or a philosopher, or whatever he is, has he got prudence? Has he got courage? And has he got patience? Not IENTS now, IENCS. And that's what it's really about, because every failure you look at, whether it's the banking, the medical, the blood bank, army deafness, you name it, it had all to do with somebody who knew what was going on was wrong and didn't stand up. And that's our problem. It's a departure from virtue ethics. It's where production outweighs protection and where everybody has a price. And the only problem is that it's so low.